Hi everyone, this is Dr. Daisy Ayim. I'm a board certified cosmetic surgeon based right here in Houston, Texas. Ozempic face. When you hear Ozempic face, you immediately have this perspective of what it is, right? Well, Ozempic is a GLP-1 receptor agonist that is very popular. It's intended for diabetes, but a lot of patients or non-patients are using it for weight loss. So you have a huge amount of people using Ozempic, Wegovy, Mounjaro. They're all in the same family. And then you have this Ozempic face, and we've talked much about it. So what is the Ozempic face? Number one, you lose a lot of fat on your face when you're taking Ozempic. And the fat is concentrated kind of in your mid face, your tear trough area, and your temple area. You lose those fat because the face is a very small area of fat. So it's the first to go when you're taking this medication as opposed to your body. So when you lose this fat, you just have this overall sunken look on your face. You look kind of hollow. Losing fat takes away your youth, because fat is very important in the face to keep us youthful and vibrant. So with Ozempic, you are aging faster and quickly and drastically. So you have this overall sunken look. The next thing that it affects is your skin. Because there's a rapid loss of collagen and elastin, you tend to have excessive sagging and loose skin that is just easy to stretch and doesn't really give you that snapback quality. So you end up having redundancy of skin. And that is something that obviously most patients don't like that. And then another thing that happens that you don't really think about is that you get more wrinkles. And that's because the texture of the skin is more pronounced. So you have this dimpling and wrinkly effect. So Ozempic face comes with all these other things that you didn't really sign up for. And side note, guys, if you're over 40, you tend to have more of this Ozempic face look. So keep that in mind as you're taking this medication. And if you're thin in nature and you're losing weight with Ozempic or any of the other medicines, you tend to look more drastic on your face than someone that has more excessive fat pad. So how do we treat Ozempic face? What can we do to restore your face when you have this effect? Number one, volume replacement. We have to replace volume. So we start with our dermal fillers, and that's your hyaluronic acid-based fillers. You're talking about your Juvederm, your Restylane, RH collectors. Just basically put some fillers back into the tear trough, in the nasolabial fold, in your cheek area to kind of gives you back this volume. Then the next thing you can also consider is your biostimulators. We're talking about Sculptra and Radius. This is really helpful to stimulate your body to produce that collagen and help restore your face to how it was before, okay? And then we have to address the skin. So your radiofrequency microneedling, like a Morpheus 8, is very good to pull the skin, contract, and gives you tightening. Alrighty, and then we have non-surgical option like a face type, which also uses radiofrequency to help pull the skin in the neck, the jowl, the lower face. So you're having like a facelift, but without a facelift. Okay, so that's like your face type procedure. That's very helpful. And then finally, you have to have some good skincare product to restore the quality of your skin. So you want to get a medical grade skincare product that has your good stuff to help with your skin. Those are like your antioxidant and your retinols in it, alrighty? Then you have your surgical option, restore fat. If you lose fat, replace it with fat. So you were talking about fat transfer to the face, But the key thing with that is when you're losing all this weight, more than likely you've lost it in your body. So you don't even have a good fat store for us to retrieve and replace it in your face. So that's something to keep in mind. But fat transfer is an option, okay? Then you have your surgical option with your facelift. You can be a full facelift, a mini facelift, or a lower facelift with a neck lift. So surgical revision is something that you can actually do to help with this Ozempic face, alrighty? Last but not certainly least, think about your PRPs, your exosomes. That's still very useful. You can do it as a non-surgical option or in conjunction with your surgical option. And that's something that can be very helpful with the Ozempic face. But I always tell patients, prevention is better than cure. So if you're going to take an Ozempic or a counterpart of that nature, think about start replacing volume while you're on it. So as you're gradually losing weight, which is the ideal way to lose weight with Ozempic, start using your fillers so that as you're losing weight, you're restoring volume. So it's a nice way to keep it harmonized and not have this drastic look in the journey, okay? So keep that in mind. Hydration is very important for your skin. So that's a good thing to do while you're on Ozempic. Hydrate. And then, of course, increase your protein intake so it can help balance. It's like the pillar to your collagen. So you want to take lots of protein and, as I mentioned, water. And overall, just take good care of yourself. Remember, less is more. Slow is better than fast. And if you happen to have this Ozempic phase, I'm in the Houston area. You can reach out to me and I'll take good care of you.
A Moment of Zen is brought to you by the Polished Beauty Podcast with Dr. Daisy Ayim. Hey, ambitious women, ready to shine on the inside and out? Tune in to the Polished Beauty Podcast, where we talk about business, beauty, brains, and body all in one spot. Meet Dr. Daisy Ayim, triple board certified cosmetic surgeon, pro-aging advocate, fitness enthusiast, and your go-to for real talk on leveling up every part of your life. The Polished Beauty Podcast is your dose of ambition meets empowerment. For more information, head to polishedbeautypodcast.com.